Hello, I'm Dr. Keith Forwith, and today I'm going to talk about the advantages of ear tubes. We call ear tubes ventilation tubes because they provide a way for air to get inside the middle ear space and for fluid to get out of the middle ear space. In other words, they replace the natural function of our eustachian tube. The tubes have some other advantages too. So not only do they replace the function, but if we have an open tube in the eardrum, it allows a way for the infected fluid to get out, but it also allows a way for eardrops to get in. If you look at the ear before an ear tube is placed, there's no way an eardrop that contains antibiotic or steroid or any other type of medicine would do any good because the infection typically is behind the eardrum and the eardrum is sealed up entirely. So if we put drops into the ear, they would accumulate here and not be able to get to the infection. If we put a tube in place, now there's an opening and there's a pathway and the drops can get into the middle ear space. Eardrops, because they can go directly to the source of infection, are much more effective at eliminating middle ear infections and oftentimes reach concentrations that are 1,000-fold higher than what you can get by taking oral medications. Plus, you eliminate the side effects of stomach upset, diarrhea, diaper rash, all these things that we can see with oral antibiotics, you don't get with topical antibiotic drops. So one of the great advantages of having tubes is that you can treat it topically. Another advantage of having a tube is if a child gets an ear infection, before tubes, they accumulate fluid behind the eardrum. And you have to go to your doctor to know for sure if that ear is infected. With a tube in place, the fluid will drain out, down the ear canal, and out to the ear where you can easily see it. And typically, infected fluid draining out of an ear tube looks like blood, pus, or snot. Things that you normally might think would come out of the nose, when you see it coming out of the ear, almost everybody recognizes that that's not normal and that's a sign of infection. So the tubes ventilate the ear, they drain the ear, they allow for topical antibiotics to go into the ear, they allow for easy detection of an ear infection in a young child because you'll see the drainage coming out to this part of the ear. And then finally, one of the real advantages of tubes is that the tube does not allow fluid as it continues to accumulate inside the middle ear. It doesn't allow the eardrum to stretch. The stretching of the eardrum is what causes pain. This is why your child is screaming in the middle of the night, because the stretching of the eardrum is quite painful. With a tube in place, no pressure builds up because the fluid continues to ooze and drain out, and so it turns a painful ear infection into typically a painless ear infection where the only sign is this fluid draining out of the ear. So lots of advantages to tubes, and I'd be happy to talk with you whether tubes are right for you or for your child. Thank you for listening.